Real talk about heart valve disease.
We spend some time talking about heart disease, but there's a particular type that's going undetected unnecessarily and undertreated, and that's valvular heart disease.
Even though heart valve disease affects more than 11 million people in the United States, many people don't know they have it or how quickly it progresses.
Since I've gone through my procedure, I look back and think about all of the things I did not pay attention to, or I wasn't even aware.
It's really important to be focused on going to the doctor every year, talking to your doctor about it, and knowing whether there's a risk for you to have heart valve disease, because it can make a big difference.
There are a lot of risk factors for heart disease, hypertension, smoking, family history, and genetics. So just knowing the family history is very important. We look at their blood pressure, we check their cholesterol, look at their BMIs to do a profile to see what they're at risk for. But if I was to give the advice to a patient, it would definitely be to tell, I have a family history.
I like to keep things real. So if there's one take-home message that I would say to anyone who's listening to this, when you go to a doctor's office, ask or nurse practitioner or a PA, ask your provider, did you check my heart? Just ask the question. And then if they say yes, then say, what did you find? They may find a heart murmur. That's sometimes the first point of detection of the potential for a heart valve problem.
I think another important point is that a lot of people don't even know what a murmur is. So a lot of times patients will say, I have a family history, my family has a murmur, or I have a murmur, but they don't necessarily understand what that is. So just to break that down, that is just a sound that is made anytime blood travels through your heart. So it could be something that is good, or it could be something that is bad.
But the most important diagnostic tool is something called an echocardiogram, and that's where you get an ultrasound of your heart. And that ultrasound gives tremendous information to the physician. So if you have symptoms and your doctor's wondering about your heart, often an echocardiogram is the place to start.
If you let it go too long, then you will develop irreversible damage to your heart, and it will never get better.
Once it progresses, all roads lead to heart failure.
With heart valve disease, waiting is not winning. That's why it's important for us to screen patients starting at age 65.